Hi guys, how is everybody today? I'm coming to you from Laser Focus Health and Wellness. I wanted to talk to you about our kids. It's a big topic just because I see so much kid health, but also just talking to so many parents, and whether it be patients or whether it be at a sport activity or a school activity, or talking to the teachers, it is just something that is very common, that being concerned about our children's health. So the research I was reading about it was talking about like the reason why it's affecting like our children, the children that are being right now, that generation, why it seems to be such an even bigger factor. So this generation that is coming up, the rate of diabetes, obesity, heart disease, high blood pressure, pre-diabetes, arthritis, joint pain, like all of that is happening at a skyrocketing rate in children versus adults. So the way that our food is nowadays, it used to be called like processed foods. They are now using the words called ultra processed foods. And so 80% of the American diet is ultra processed. And so those types of foods were really starting to happen in the 80s. So when you kind of think about it, my generation was being raised on ultra processed foods, whether it be a high sugary cereals, Pop-Tarts, ding dongs, Doritos, like these types of foods that are ultra processed and provide zero nutrition. So it was a big part of my diet as a child, and so we in the 80s, early 90s, we were raised on that type of food. So fast forward to my generation, me being raised on that food and then becoming pregnant. So then that was the first generation that was eating that way, pregnant. And then all of that ultra processed foods, all of the non-nutrients, all of the chemicals, all of the dyes, all of the fake sweeteners, they're all crossing the placenta. So the children that are being born and raised right now are just already at a disadvantage. Their immune system is lower. Their genes are mutated. The fat cells are ignited, so they're easier to grow. We all carry cancer cells, but we're now feeding those cancer cells more. So then that is happening at a faster rate. So much more is happening now and at a faster rate, and not just in adults, but in our children. So when you think about it, like how if you're in your 30s, 40s, of how you ate as a child, and how those foods were coming about, and that ultra processed type of food was coming about, and then maybe how you ate pregnant, and then seeing it in your children, to where maybe they don't like fruits and vegetables. Maybe their diet is very strict and very small, and it's just fried foods or fast food, and that's all that they want, because the fruits and vegetables don't taste good. So it is it really is. It's something that, it's kind of, you can talk about it and see it and be aware of it, but in the grand scheme of life, like, it really is kind of a big deal of how it is affecting the generation to come. So that generation that is coming up is it is expected to be the first generation to not outlive their parents, because of that timeline of food. With that being said, I cannot press anymore the importance of feeding your children real food. Of course, I want it for you, but even more for your children. They are at the mercy of what adults give them. whether they like it or not. So introducing those foods and their body's not relying on food that provides no nutrition, but just chemicals. So it is a big thing to kind of sit back and think about of where it started and where it's going, and what can we do as adults, whether it's you're an aunt, uncle, a parent, a teacher, if you have children in your care and feed them, what can we do about that? So that is the big question. What can we do about it?